Introduction: antibiotics are essential medications used to treat bacterial infections by either killing bacteria or preventing their growth. They are prescribed for a wide range of conditions, from ear infections to more serious illnesses like pneumonia. Dairy products, such as milk, cheese, and yogurt, are common staples in many diets worldwide, valued for their nutritional content, particularly calcium, protein, and vitamins. Mechanism of interaction. The interaction between antibiotics and dairy products primarily revolves around the absorption and effectiveness of antibiotics. Certain antibiotics, particularly those in the tetracycline and fluoroquinolone classes, can form complexes with minerals found in dairy products such as calcium, magnesium, iron, and zinc. These complexes are insoluble and can reduce the absorption of antibiotics in the gastrointestinal tract, thereby decreasing their effectiveness. For example, tetracycline antibiotics bind readily with calcium ions, forming insoluble complexes that are poorly absorbed. This reduces the amount of antibiotic available for systemic circulation, potentially compromising its ability to combat bacterial infections effectively. Health risks and considerations. The main risk associated with consuming dairy products while on antibiotics is reduced antibiotic efficacy. If antibiotics are not absorbed properly due to interactions with dairy, the bacterial infection may not be adequately treated. This can lead to prolonged illness, recurrence of infection, and in severe cases, antibiotic resistance. Furthermore, consuming dairy products high in fat can delay the absorption of antibiotics in the stomach, although this effect is generally less pronounced compared to the mineral interaction issue. Cultural and dietary implications. In many cultures, dairy products are a significant part of daily meals. From cereal with milk for breakfast to cheese and sandwiches and yogurt as a snack, dairy is commonly integrated into various dishes. However, when individuals are prescribed antibiotics, especially those known to interact with dairy, it becomes crucial to consider dietary adjustments to ensure optimal treatment outcomes. Case studies and statistics. Clinical studies and case reports highlight the impact of dairy antibiotic interactions on treatment efficacy. Research has demonstrated that taking tetracycline antibiotics with dairy products significantly reduces their bioavailability. For instance, a study published in the Journal of Clinical Pharmacology showed that consuming milk with tetracycline antibiotics reduced absorption by up to 50%. Statistics from healthcare settings also underscore the prevalence of this issue. Many healthcare providers routinely advise patients to avoid dairy products when taking certain antibiotics to maximize treatment effectiveness. Regulatory and expert opinions. Health authorities, including the FDA and European Medicines Agency, EMA, provide guidance on the administration of antibiotics to optimize therapeutic outcomes. They recommend separating the consumption of dairy products and antibiotics by at least 2 hours to minimize interactions. This allows antibiotics to be absorbed adequately without interference from dairy components. Healthcare professionals, including pharmacists and physicians, routinely educate patients on the importance of adhering to these guidelines. They emphasize the need to follow medication instructions carefully to achieve the desired therapeutic effects and avoid potential complications. Preventive measures. To mitigate the risk of dairy antibiotic interactions, individuals can take the following preventive measures. Read medication labels. Pay attention to medication labels and patient information leaflets provided with antibiotics. These documents often include specific instructions regarding food and beverage interactions. Follow healthcare provider advice. Consult with a healthcare provider or pharmacist about dietary restrictions while taking antibiotics. They can provide personalized recommendations based on the type of antibiotic prescribed and individual health considerations. Adjust meal timing. Separate the consumption of dairy products from antibiotics by at least 2 hours. This allows antibiotics to be absorbed effectively while still enjoying dairy as part of a balanced diet. Consider dairy alternatives. If avoiding dairy products is challenging, consider dairy alternatives that are lower in minerals, such as almond milk or lactose-free products. These alternatives are less likely to interfere with antibiotic absorption. Conclusion. In conclusion, while dairy products offer valuable nutrients, their interaction with certain antibiotics can compromise treatment efficacy by reducing drug absorption. Understanding the mechanisms and risks associated with dairy antibiotic interactions is essential for patients and healthcare providers alike. By following recommended guidelines and making informed dietary choices, individuals can ensure that antibiotics are effectively absorbed and bacterial infections are treated optimally. Healthcare professionals play a crucial role in educating patients about these interactions and providing guidance to enhance medication effectiveness and patient outcomes.